How relationships can improve your health and how loneliness can affect your health. It's a project that I did this year, and I think it's a very important topic to discuss, mainly for the elderly population. So let's jump into it. Loneliness has been a huge issue in our older adult population in the United States. Studies have found that loneliness can increase a person's risk of a premature death that's comparable to other risks like smoking, obesity, physical inactivity, and so forth. According to the CDC, about 50% will have a 50% increased risk of dementia. Loneliness is also associated with a 29% increased risk of heart disease and a 32% increased risk of having a stroke. Loneliness also leads into depression, anxiety, and suicide. With people who have heart disease and loneliness as a combination, they are associated with 4 times increased risk of death. They have a 68 increased risk of hospitalization, and they have a 57% increased risk of emergency department visits. Humans, we are social by nature. We are meant to be social, and individuals who have strong social connections have a reduced risk of health conditions like heart disease, stroke, dementia, and depression. So that shows you how important being in a social or having social connections is. Um, these people who are in these groups or even have a community of the same interest or same hobbies, um, or have a supportive relationships, um, they result in better healthy choices and better mental states and better physical health as well. So it's very very important that we remain social or have some type of connection with other human beings as we progress through this journey called life. Even dating, now that's not rocket science. Of course dating is going to have some benefits there, but we're not talking about none of that toxic stuff. We're talking about healthy, mature relationships. And that has been shown to lower stress levels, help with better healing after surgery, healthier behaviors and choices, longer lifespan. That's important. Also important, intimacy has been found to ward off depression because depression is another problem within the communities around the world. So I'm not telling you to set your grandparents up on a date. I'm not I'm not saying that. What I'm saying is try to make sure they stay socially connected, especially among their peers, among common interests that they have, and so forth, because it's very, very beneficial to their health. And that's all I have for today. Peace and blessings.